As Dr. Lee stated, this is all about our patients, and so we so much appreciate the gift because it will help our patients. And now I want to introduce you to a very, very special individual, a young man who has taught me a lot about courage and resilience, someone who went through some tough immune-based therapies, and Jason Connelly, who then actually during the whole treatment he was blogging about it, and I had no idea, but I'm kind of glad I didn't know why he was doing that. But he's got an incredible blog that you should read sometime. But he's an incredible young man, and it gives me great pleasure to introduce him right now, Jason Connelly.
One of my favorite people. Good afternoon, my name is Jason, and last May, during my last 3 weeks of my first year in school for my MBA, my life took a drastic turn. I was diagnosed with stage 4 melanoma in my abdomen and possibly in my lungs and in my brain. Just so you know, there's no stage 5. I was diagnosed through exploratory surgery. When I came to after surgery, I asked Dr. Mansfield how it looked. He said, "You have a lot of bad cancer in there." I said, "How many tumors? 1? 5? He said, "Hundreds or thousands." I started chemo 3 days after that. I looked it up on the internet, and as it turns out, patients with stage 4 melanoma live an average of 8 months after diagnosis with treatment. My goal, 20 years. I have to tell you a story about when I first got sick. You see, my belly was swelling for no reason. I was having cramps and nausea and trouble sleeping. When I ended up in the emergency room, I told the doctor about my symptoms, and then I said, "I guess I know what it's like to be pregnant now." She looked at me with the most serious eyes I've ever seen and said, "Son, you have no idea." It's the truth. I want to tell you about my experience so you can understand the importance of what we dedicate today and the gift that's been given. Rather than look back and tell you what I remember, I've decided to read some excerpts of the online journal, also called a blog, that I kept during my treatment. May 5th, 2006. To loving family, dear friends, and respected colleagues. As some of you know, I spent most of the last 2 weeks in the hospital with an unexplained swelling in my belly. I had exploratory surgery Tuesday, and it was confirmed to be caused by melanoma, a malignant cancer. I had melanoma removed from my back in October of 2000, and it was never expected to return. Well, it did. Unfortunately, it's not operable. It's covering my peritoneum, the bag that holds my organs in. Luckily, it has not spread to any other organs that we could see yet. I'm at MD Anderson Cancer Center in Houston, the top cancer center in the world. My doctor is awesome, and I trust his judgment completely. I'm very weak from the drugs, and Jennifer is very tired from the stress. If you have a question about this cancer or the drugs I'm taking, please look it up on the internet. Keep in mind that every cancer is unique, and you have to take what you read with a grain of salt. Thank you for your prayers and thoughts. I plan on getting through this and ending up in full remission. There's no other alternative I will accept. This is during my second round of chemo. May 27th. I have a lot of these, so hope everybody's comfortable. May 27th, 2006. I woke up this morning and I wasn't sure where I was. Then I remembered the cancer. It sounds terrible, but it was actually a good thing. Usually, I can't stop thinking about it. The fact that I forgot it for a while means that I've been thinking of something else while I was sleeping. So here I am in the hospital, same basic room, same nurses, blankets, TV shows, etc. I'm officially back. Some things are different. My hair is gone. It's funny, but it doesn't look half as bad as I thought it would. My head gets cold, though. Still, the things that are the same overwhelm me. Did I even leave? I start my 4th drug today, and the 5th in 4 more days. I'm excited about this round because I feel we're trying some new things. Plus, about 2 weeks after this round of chemo, they're going to open me up and take a look around to check the progress. That'll be the real defining moment. Is this working or not? The $10 million question. Going to stick to my goals today. I woke up and cleaned up and went to the nurse's station to make and get coffee. I just ordered a big breakfast, and I plan on taking a walk afterwards to get some fresh air. I think this will be better if I can make it a morning and afternoon routine. Oh, the other goal of not focusing on how bad I feel, I smiled at every person that woke me up in the middle of the night to poke and prod me. July 4th, Independence Day. All right, everybody. I know it's been over a week since my last post. I can't really claim to be too busy. I've just had other things on my mind. The first half of my treatment went well. They started me on the chemo Wednesday, and I finished it Sunday night. Just like last time, I tolerated it well and kept my appetite throughout. In fact, the doctor might recommend that for the next course I do the chemo part outpatient. I would still have to drive to the hospital every day for 5 hours, but I get to sleep in my own bed. Now for the second phase of treatment. The doctors decided to start the biotherapy Sunday night while I was still receiving the chemo. I've been sick since. This drug is really mean. I've eaten so little since I started, you can count it as not eating at all. I'm in really bad shape, but it's just the side effects of the new drugs. The same thing happened to me last time. Happy 4th to everybody. Remember what this holiday means. It represents the birth of the greatest country on earth. Give her a good party. I missed every good holiday in the hospital. August 8th. The last you heard from me, I had done the outpatient chemo and was going back for the inpatient portion. For the most part, the chemo sucked. My words, sorry. They give me 2 drugs inpatient, IL-2 and interferon A. The IL-2 is an immune system booster, and it makes me sick to my stomach. The interferon is a synthetic version of the chemical messenger the chemical messenger in your body that tells you you have the flu. They call the side effects shake and bake. This is because I alternate between horrible chills and fevers of over 102. The combination of these 2 drugs is just miserable. Not to mention they give me about 5 other drugs with them, including dopamine. I've been thinking a lot about life expectancy lately. It seems that even if I go into permanent remission, this will be something I will deal with for the rest of my life. The odds are in favor of me fighting this cancer again. I'll beat it this time, but I just can't realistically look forward to living to 100 anymore. I know it's depressing, but what the heck? I can't be a ray of sunshine all the time. Right now, I'm just looking forward to my birthday. It is in less than 2 weeks, and my family's going out for a nice dinner. I will have been out of the hospital for a long time, so I should be able to enjoy the food. I might even try a glass of wine or 2. Later. October 26th, great news. Hello, faithful readers. I hope things are going well in your corner of the world. If you're facing adversity or difficulty, continue reading. When it's darkest, the stars shine the brightest. There's the real possibility that my cancer is gone. I'll say that again. There is the real possibility that my cancer is gone. That's how it was written in the video. I went to the doctor yesterday to get the results of my scans, and the first thing the PA said when I asked about the test was, well, we might not have gotten all of it. That sounded like bad news, but what she was saying was, we might have gotten all of it. An important point to remember, even if the cancer isn't gone, it's been shown that it responds to the chemo. If I have to go through 1 or 2 or 3 or 4 more treatments, so be it. It's working. The fact is, I will be healthy again. We're winning this battle. The cancer is losing. Hoorah.